2 years after my diagnosis, I had my first round of anterior uveitis, which is also called iritis, and it's inflammation in the front portion of the eye. They split it into 3 sections. It's if you have uveitis, you're going to have anterior uveitis, intermediate uveitis in the middle of the eye, and then in the back of the eye, posterior uveitis. And so 2 years after my diagnosis of my autoimmune disease, it hit my eyes. And back then, I remember I was riding home. I was in the passenger seat in the front, and we had gone to the ocean for the day. And I was riding home, and just all of a sudden, out of nowhere, it just felt like somebody came out of nowhere and just shoved a knife through my eye. And I remember doubling over in the car, and I was like, "Oh, what was that?" And I stayed there for a minute, and then I came up, and I was like, and that pain didn't stop.
Right.
And it was Memorial Day weekend, and this was Sunday. So on Monday, of course, I can't go to the doctor.
Right.
And I don't know really about uveitis yet.
And
it's too
how
new.
Crucial it is to
right.
get there
So
soon.
I did get into a doctor by Tuesday, and they treated me immediately. It was Pred Forte so many times a day. I don't remember how many times a day. It was a lot. And they put me on homatropine, which I don't even think is available anymore. It was a dilating drop back in the day.
You had to have your eyes dilated a lot.
They dilated the eyes a lot. There's a couple reasons for that. They dilate to help prevent damage, keeping that adhesion with the lens from happening from the inflammation. But also, if the eye's not dilating and constricting constantly, there's less pain. So a lot of doctors will do it just to try to help with pain control.
But then you can't see much.
Right. No, it's blurry. It's really blurry when you're dilated like that. And so that first time, I did, it was like, it took like 3-month treatment, and then I was fine.
Right.
And it was fine.
For quite a while.
For a long time.
Yeah.
And then over the next few years, it happened a couple more times, always in my right eye. It happened a couple more times. And again, I would go get the quick treatment, topical steroids. I did start having right away steroid reactivity, where they had to, where they had to also add drops for intraocular pressure issues. So some people really react to steroids and their pressure in their eyes goes up, and some people don't. I do. It's a problem for me. So now it's a lot of drops.
Yeah.
And then I'll never forget it. After years of dealing with this disease and a little bit of a lull where it wasn't gone, but
it wasn't every day.
It was, well, I'm not talking about the eyes. I'm talking about body wide. It's not like it was gone, but it had become more bearable. The pain was not unbearable all day, every day anymore. It was more bearable. And some of that was my pain tolerance had changed. And I know that because I remember one day I was working with, I do a lot of home improvement. I always have kind of this old house kind of stuff. And I was working with a drill in my stairwell at the time, and I had put it right through my hand, and I didn't even know it until I saw blood.
Right.
So, and I never did feel it. I mean, it just never hurt. It just didn't hurt. And I think that something happened where my brain was just like shutting off pain signals. And I don't take painkillers. I'm actually allergic to any. They gave me some with my shoulder surgery, and I was crazy allergic. So I don't take painkillers. Good for you if you can. I can't.
And which has also saved you from some of the issues people have.
Right. It has saved me from some of the, but if there was pain control, maybe some things like my blood pressure might be a little better.
Right.
And when you're in pain all the time, it's not good to,
your whole
it
body,
affects everything. So if you can get pain control,
sleep and everything.
Right.
Yeah.
It affects everything. So pain control is important. I can't take pain pills. So 2008 in May, the uveitis comes back with a vengeance. It was bad.
Yeah.
It was really bad. It was my right eye again. At this point, I'd never had it in my left eye. And it just was so bad. And I went to my optometrist at this point, and he treated me for a little while. And this was in May. By by the end of that year, he's talking about getting me to a uveitis specialist because it's just not getting under control.
Right.
And he wants me to consider immunosuppressant treatments, biologics. At the beginning, when I was first diagnosed, undifferentiated, the treatments that they did back then, they did sulfasalazine, they did indomethacin, which will rot your gut out.
Right.
They did methotrexate, which I can only tolerate methotrexate by injection because it really wrecks your gut.
It does, yeah.
So, and the injections, we'll talk about injections another time, but so that was what I did back then in the 90s. And then, so now fast forward 2008, they want to try biologics because it's my eyes.
Yeah.
And so we started that road. We got an appointment with a fantastic uveitis specialist in our state, about an hour away from where I live. And because he had to weigh in on whether biologics would be the right next choice.
Right.
And also the rheumatologist had to be on board. And my rheumatologist was actually trying to talk me into it too.
Right.
Because I hate drugs. I hate medication.
And those ones are
I just really want to I hate it. I hate it. So, it's not like I live on organic, if I'm at Fenway Park, I'm having a hot dog, right? But
when you read the pamphlets that go with those.
Right, but I just don't want all that in my body. But I'll tell you what, when they tell you it's your vision, it's like, what do I do? I'll do it, whatever you want to do. And I learned, later, I didn't know this at the beginning, but I learned it's not just your vision at stake, but it's actually your eyes. People have lost their actual eyes with this disease. So, yes.
You were willing.
I was, yeah. So, I remember when I finally got to the uveitis specialist, at that point, I had anterior uveitis in both eyes, and scleritis in both eyes. And he's talking to me about immune suppressant drugs too. And he says to me, because I didn't even know what scleritis was. The sclera is the white part of your eye, and that can inflame too, and it does for me sometimes.
Right.
It's been a while since I had scleritis now, but it was bad that day. And he backs up in his little chair and he says, "Did you know your sclera can liquefy?"
Scary.
And I was like, what? That's what? I mean, I just, how do you even respond to that? It's like, can you inject me right now? What do we have to do? Because let's not do that.
Yeah.
Because that's,
Yeah.
So then I started the preparations that you have to do to go on a biologic. You have to have a physical, you have to have a TB test, you have to have
X-rays.
You have to have a pneumonia. There's like a whole thing that you have to go through to go on them. So 2009, April, I went on my first biologic.
And that one was
Humira.
And that lasted how long? How long were you on Humira before you?
I was on Humira because of my eyes now for 3 years. And what I learned is that just like the inflammation in my knees and in my sacroiliac and in my neck and oh my word, my sternum joints, like they're always inflamed. They're inflamed right now sitting here. It's terrible.
Yeah.
Just like those places where that inflammation can just come and stay, it can come and stay in your eyes too. Which is what happened to me. It became chronic in 2008 and has stayed that way.
Yeah, you've never been free of
No,
of it
and so even when it's quiet, it's not gone.
Right.
The inflammation is there and it's not going into some massive flare.
And the quiet is because of the drugs that you're
The quiet is because I'm on a biologic and I'm taking steroid drops and all of this stuff to keep it there.
Right.
And so Humira did that, kept it pretty quiet. And for me, with my eyes, what I call simmering, when it's kind of quiet, I'm seeing an eye doctor every month.
Right.
When it rages and flares, it's 2-3 times a week.
Right.
So I see my uveitis specialist 1 month, and then the next month I see the optometrist for a pressure check.
Right.
And then I'm back to the uveitis specialist, and then I'm back for a pressure check. So that's been the last almost 12 years of my life. month in, month out, year in, year out. That's what it's been like.
Mm-hmm.
And they're in pain. They're never not in pain, ever. It's just a range. Like, how bad is it? And the headache from them is always there. Always.
And they started
always.
you on the oral steroids too. At what point? I can't
remember
what year.
I don't even remember.
I don't even remember.
So that was something that got added along the way somewhere. Because now this was the reason for that. So it was just anterior uveitis for a long time, and I don't say just meaning if you only have anterior uveitis that you're not suffering, because I know you are, but I should say it was only anterior uveitis for a long time, plus scleritis in there sometimes, and then it became pan-uveitis. I had inflammation in the anterior chamber, intermediate, and in posterior, and the drops do not affect any. They don't
get to that.
They do not control inflammation
in that part,
especially in posterior uveitis. So when he looks in there and he sees that the posterior portion of my eye is raging with inflammation, he's like, "We've got to do oral steroids. I know you don't want to, but we have to." And I did my first ever prednisone burst, where it's like massive amounts of milligrams of prednisone. Right. You take that much for this many days, and then you reduce by 5 milligrams every 5 days or 7 days, or whatever the schedule was that he wrote up at the time. It changes.
Right.
And so that happened.
And you've had to have bursts periodically.
Yes.
Yes.
And I don't even remember when
when you're not on a burst, you're on a maintenance dose.
Yes. I have not been off oral steroids for years.
Right. Right.
And so I get a permanent moon face.
Which I don't see. You see.
And I used to be the same size as her. And so...
You still look great.
It's better than blind. I'm sorry. If you'd rather be skinny and blind, go see a psychiatrist. Seriously. Yeah. So your option is put on some weight with prednisone or go blind. I mean, that's a no-brainer. So with prednisone, there's very specific places that the weight goes. It all goes in your trunk. So I'm still in the same size jeans I was in 10 years ago. But it all goes in the trunk and the face. So this is just what I live with. And it is better than losing my eyes. And it is better than going blind. I do work out. I can't do the heavy working out that I used to do, but I do use an exercise bike as much as I can to try I don't lose weight.
Just you maintain.
But to try to keep from gaining too much. I gained 5 pounds every time they've done a burst. Every single time I've had to do a burst where I do more than the maintenance dose, I've gained 5 pounds. Every time. Oh, my dog has to go on prednisone, and he's gained 5 pounds. He's a golden retriever. He has gained 5 pounds every time too, and he hasn't lost any of his either. So we both have gained like 25 pounds from all the bursts. So, and it just doesn't ever come off.
But you've done a really good job of keeping yourself maintaining, because some people really struggle with steroids.
Right, and I don't think that some people don't gain anything on steroids. Some people gain 100 pounds, and I think you just don't know.
Everybody's different.
Right, and nobody should blame themselves if that happens.
Definitely not.
The problem,
like you said,
right?
You're having functioning eyes, and some people have to take steroids for other reasons, but in your case, it's for your eyes.
Right.
It's well worth it.
Well, what choice do I have?
Exactly.
Right. So, this was pretty long. I think we should wrap this one up, and we'll do the next one. We will talk about what was next when I had to stop biologics because they landed me in the hospital.